Okay, now we are starting a cystoscopy, and here the bladder is closed now, empty, all empty, and I'm seeing the urethra, which is normal. When I entered the bladder, I just this part. See, this part was the part which come into contact with the bladder triangle. Look at this part. This part is reddish. The normal bladder mucosa. This is the place which comes into contact with the trigone, and this is a normal mucosa again. And in the trigone, what we see is, as usual, we have these Leukoplakia tissues and patchy tissues that's never healed with classic antibiotic treatment. This is left uretary orifice, here trigone. Look at these tissues. When I scrape them, they fly away, and they will bleed now. Very really ill tissues. They go till here, and in the back wall they always do inflammation here. So I wish the bladder is not affected from this issue. Now I'm looking at the bladder and try to see if there is any bleeding in the bladder wall. Up till now it seems healthy. It isn't bleeded yet. Okay, I think it will not bleed. This is a good sign. And see one more time, once again. This part is coming into contact when bladder is emptied. I'm in the bladder neck now. The bladder is emptying, and I close the fluid irrigation. Okay, when it closes, that part comes into contact, and next to it, the inflamed area is next to it. So maybe this is the part which comes into contact with the trigone. Okay, so now I will begin marking the tissues. One more time. I don't want to forget this area. I mark this. And when I empty the bladder, it isn't bleeded. It's a good sign. Here are the leukoplakias. I will fulgurate them. Okay, now we fulgurated these parts, and they really become good, healthy tissue underneath the fulgurated area. Came out. This is really good and healthy. And in the opposite back wall, opposite side, I fulgurated two areas. They were inflamed. Look at this tissue. It is reddish, and when I look to other parts, this is a normal bladder mucosa. This is not a normal mucosa. So maybe I have to fulgurate this part. I don't want to make too much fulguration in these parts, but to start a new mucosa formation, to stimulate this formation is nice. Okay, so I am finished now bladder, and I will look to the vagina part. Close. Okay, I'm looking to vaginal part. She has hysterectomy. I think this cervix uterus, still the end of cervix is still here. The vaginal tissues are a little inflamed. There were too much discharge. But I don't see any abnormality like a fistula or such things. This is cervix uteri. I don't think it's a fistula, just normal cervical opening. Other than this, it is normal. Oh.